Choosing Mary Bird Perkins was the best decision for me because everything lined up in terms of care, treatment, conversations. They made my journey easier. So it began in July of 2023, my first ever colonoscopy. I work out, I eat good. I said, okay, let me go ahead and get it over with. I'm gonna come out with flying colors. The doctor there called my wife and shared with her that he discovered a mass on my colon. After getting an MRI, CT scan, and they shared with me that it has moved from your colon to your liver. And so it's cancer, and it's also metastatic cancer. My world just seemed to crumble, just kind of imploded on me. And all of this information comes at you like drinking water out of a fire hydrant. It's just so much. So having that patient navigator there to answer those questions, for me, made a difference.
Our patients often begin their journey with our navigation department at their very first meeting with their physician. The navigator's role is to really add that extra layer of support in order to make the cancer treatment go as smoothly as possible.
The navigation program involves nurse navigators, dietitians, and social workers. Nurse navigators do care coordination, supportive education, and general problem solving. Dietitians help through if you've lost your weight, you've lost your appetite, you're just not sure what diet you should be on for your diagnosis. And social workers help with resources. That might be counseling to process your feelings about your diagnosis. It might be a support group to talk to other people going through the same kinds of things. It might be financial resources. One of the things that we make sure that we do is we work with underserved communities. And the way that we can do that is through a funding grant that gives us the opportunity through finance and support to be able to have specialized focus resources on those communities that generally are underserved and don't have that kind of assistance.
We're very grateful to the Merck Foundation for this grant opportunity and how it's helping Mary Bird Perkins to advance its mission. When we began this work, we spent quite a bit of time engaging with the community to better understand their needs and the barriers to cancer care that was faced. We held several community listening sessions throughout the North Baton Rouge area that really help define the work that we're doing as a part of our patient navigation program. We are really excited about continuing our work with our coalition of community partners to provide educational opportunities, to outreach within the community so that folks are better equipped with information to help improve their health outcomes.
Mary Bird Perkins uses the grant to meet the community where they are. One of the largest disparities here in North Baton Rouge includes access to medical care. Through this grant, Mary Bird Perkins is able to go into the community, create that level of trust, and provide them the quality health care they deserve.
The grant has been a significant factor in addressing these issues because it has provided needed resources. Having those community events where people can go get screened, go get tested, have access to quality produce and healthy foods, all of those things are very, very instrumental in addressing the crisis that exists in North Baton Rouge.
Having those community events allows individuals like myself to hear the messages. It allows those type of campaigns to help break down those mental barriers, those emotional barriers, whatever psych barriers that you have about getting screens. It puts you into a place where it's non-threatening. You see others that have gone through it, and you see success stories. You see survivors, and you see those that can share with you the importance of having those screens.
I think the grant is special in this community because what it does is it brings several community partners to the table. We have competitors at the table. We've got community organizations at the table, all working together to help to solve some of the biggest challenges that we face. The other thing that it does is navigation for healthcare services. This is really important to cancer patients because that human connectedness we already know leads to better outcomes. So when you have a program like this, you have a grant like this in a community with as many needs as we have, it makes a difference.